dear members of the Global Health Hub Germany, distinguished guests and colleagues, on behalf of the Federal Minister of Health, Nina Wagen, who would have liked to be here herself, it's my pleasure to welcome you here, you all. I'm delighted to continue the important discussion that opened this year's Global Health Talk, Gender Sensitivity in Healthcare. For decades, the male body was treated as the medical norm in both research and practice. Today we know that diseases manifest differently, medications work differently, and risks are distributed differently. Contingent on biological sex, socio-economic conditions, and behavioral norms. A healthcare system that fails to recognize gender as a determining factor in diagnosis, treatment, and response creates risk for all genders. Men, for instance, are often less likely to seek diagnosis and care, and I know what I'm talking about. Ignoring these differences has serious health consequences at every level. Misdiagnosis, delayed treatment, and unequal access to care. It causes suffering that could be avoided if we factored in gender for what it is, a variable for health outcomes. I'm proud to say from the beginning, this government has been united on advancing gender-sensitive healthcare as a priority in science, medical education, and delivery. For the German Ministry of Health, it created a clear mandate for action, more research, better data to close knowledge gaps, modern medical curricula, and a healthcare system that serves everyone. Our goal is clear, healthcare that is evidence-based and patient-centered. Recently, we launched 2 calls for proposal to generate scientific evidence to improve healthcare for women in Germany. Each has a budget of up to 5 million euros. Gender and health are no longer a niche topic. Rather, gender-sensitive approaches to healthcare are a defining feature of quality in modern healthcare and prevention. In this context, and on behalf of Minister Wagen, I would also like to thank Professor Voigt for her work on maternal and child health in South Africa. Minister Wagen had the privilege of observing parts of Professor Voigt's work in firsthand during a visit to the Kalafong Hospital in South Africa. Gender sensitivity at home and abroad is one area where systematic change is needed, but it is far from the only one. Globally, we have entered a phase of fundamental reform. A fractured geopolitical landscape, widening gaps in global health financing and pandemic preparedness, and a growing pressure on multilateralism are placing the global health architecture under enormous strain. Over the years, Germany has become a leader in safeguarding global health, financially, normatively, and through world-class research. However, as resources become more constrained, we must become more creative and strategic in how we can deliver the greatest impact for all. Like all stakeholders in the global health architecture, we too must redefine our role, not as donor, but as designer. At a time when the entire global health community is asking itself, what are our priorities and what roles should each individual stakeholder play, we must have our answers ready as a strategic visionary of a future-proof system. What are the areas of strategic importance in global health? What is the core mandate of each institution in the global health architecture? What activities are better carried out by others? The UN systems was created in the unique spirit of unity after the Second World War. Today, we are once again living through a period of historic significance, because the decisions we make today will shape the architecture of global health security for many generations to come. Donors will always have a voice at the table, but the future belongs to those whose vision others choose to follow. Amid geopolitical fragmentation and shifting alliances, we must work to ensure that current reform processes remain grounded in the idea that brought us all together at the United Nations 80 years ago. The idea that the big problems of our world are all interconnected and that the health of our citizens depends on the health and resilience of populations and systems worldwide. To achieve this, I believe we must focus on three key areas. First, we must all do our part to enhance the effectiveness of the multilateral health system. We are operating in an environment with increasingly weakened multilateral structures. At the same time, more complex global health challenges require stronger coordination and collective leadership. This is why we remain firmly committed to multilateralism, with a reformed WHO at the center of global health. A strong and independent WHO is indispensable for, first, setting global norms and standards, second, responding to cross-border health threats, and third, and coordinating collective action. Germany has earned a reputation as a constructive broker in international negotiations. To contribute to a shared vision for reform priorities, we must balance the needs of our scientific and pharmaceutical stakeholders while creating conditions for global advancement on an equal basis. With the appointment of a new WHO General Director in 2027, we have a critical window of opportunity to shape our collective understanding of what a fit-for-purpose WHO should look like. This discussion cannot take place in isolation. The broader reform of the global health architecture must also address WHO's future role. WHO, like a stakeholder, should refocus on its core mandates, its comparative advantage, and how to work with other global health actors most effectively. For that reason, we support the World Health Assembly's decision to launch a joint process on the reform of the global health architecture. In order to strengthen the voice of non-state actors in this process, we look forward to integrate your expertise with the help of the Global Health Hub Germany. Second, we must enhance health security and resilience worldwide. The threat of the retreat of traditional partners in health security has increased questions about how to sustain a global health security architecture capable of responding to the future threats. We know that effective responses to global health threats depend on collective action across sectors and countries. The recent Ebola outbreaks in the Democratic Republic of Congo and Uganda demonstrated, once again, the importance of rapid diagnosis, international coordination, and solidarity, as well as resilient health systems. Together, they can prevent local outbreaks from becoming wider crises. Therefore, we must continue to strengthen a global health security architecture that is resilient, effective, and fit for the future. The WHO's role in coordinating multilateral health security is not optional, it's indispensable. Health security also requires efforts in national level aligned with global and regional health security agendas. We must continue to strengthen the resilience of our national healthcare system to ensure that it remains responsive under pressure during times of crisis. Germany's upcoming Healthcare Security Act, called GESIG, will strengthen this foundation. Third, we must expand the EU role in global health. Going forward, the EU must become a more strategic stakeholder in global health. and it has strong assets to build on: robust healthcare systems, world-class research and innovation capacities, decades of experience in international cooperation, and successful European initiatives that have helped to strengthen global health resilience. Unlocking the full potential of these assets will, however, require greater unity and clarity on priorities and political commitment in order to place global health firmly on the European agenda. It will also require a common understanding among all member states that European engagement in global health creates added value, not only for our partners, but also for the European Union itself. The recently adopted EU Global Health Resilience Initiative can serve as a vehicle for strengthening alignment among member states on financing, strategic priorities, and preparedness for health emergencies. I am, therefore, pleased that tomorrow's panel with international health experts will include a representative of the European Commission. This provides an excellent opportunity to hear directly about the objectives of the initiatives, the ambitions behind it, and the impact it can achieve. As a strong advocate for multilateralism and strategic convener in the EU, we will strengthen coordination towards a more unified European voice in multilateral health fora. And perhaps, most importantly, we can serve as a bridge with the European Union itself by helping to transform shared ambitions into European action. Now, having outlined our priorities, an obvious question remains. Will global efforts be successful? Will these reforms achieve their goals? We cannot know yet. Minister Wagen and I can, however, assure you that the Federal Ministry of Health stands ready to support the process to the best of our abilities. But government actions alone has never been sufficient in global health. We rely on the expertise and advice of no state actors. You are our eyes and ears on the ground. Your perspective and operational experience help us to coordinate effective responses across sectors and disciplines. By bringing together global health experts from various stakeholder groups and acting as a bridge between the non-state sector and the political space, the Global Health Hub Germany champions this purpose. Your cross-sectoral input and expertise inform political decision-making. I very much look forward to your findings and policy recommendations in the Future Lab. Ladies and gentlemen, these are challenging times for global health. But this forum, the Global Health Talk and the Global Health Hub exemplify what we need for the future: collaboration, cross-sectoral expertise, and strategic dialogue. The Hub is only as strong as the engagement of its members. Therefore, I thank you all for your commitment with the Global Health Hub Germany. With that, I wish you a successful conference and stimulating discussions. Thank you very much.